Yeah, but we're going to have a dog.
She and I were at a toy store, and all of a sudden she just couldn't complete a word. She had picked up a stick horse, and she was riding the stick horse, and she was trying to say giddy up, and all she could say was, she kept getting stuck at the very beginning of it. She was going get, and that was all she could get out. And I recall that she grabbed her mouth to try to make her mouth work, and I just started crying there in the store. It was really, I felt terrible for her. It was so frustrating.
Perhaps you feel like these parents and are concerned that your child is beginning to stutter. If so, we hope to answer your many questions and concerns about stuttering and give you ways to help your child. The first question everyone asks is, what causes stuttering? Let's listen to several experts discuss this.
The cause of stuttering is a mix of three things. First are the little discoordinations the child may have as he is learning to speak. Second is the child's reactions to these discoordinations. And third is the child's environment, how busy and fast-paced it may be. When we work with a preschool child who stutters, we concentrate first on his environment to see if we can make it slower paced and especially supportive.
Experts agree that stuttering results from an interaction of many factors. Stuttering usually begins between the ages of 2 and 4, when children are in a stage of rapid language development. At this time, they may be more vulnerable to other stresses that affect speech fluency. These stresses may be related to changes in a child's life or to the ways families interact together.
Most experts agree that some children are born with a tendency to develop stuttering. Whether or not they will depends on the ways in which their physical makeup and environment interact during the first 3 to 4 years of life.
We are now seeing some interesting research in the areas of genetics, neurophysiology, child development, and family dynamics. This research is helping to identify the many factors likely to be related to the onset of stuttering in young children.
All children have repetitions, hesitations, and disruptions in their speech when learning to talk. We call these disfluencies. They may have more of these when they're using complicated language, or are tired, excited, upset, or being rushed to speak. Let's take a look at some normal repetitions that most children have as they are learning to talk.
We all were trying to find him, and you know what? We let them go so they can find their mom and a new home. And when tonight, I got this bowl for my family.
We become concerned when children have more frequent and longer repetitions, like this, and prolongations of sounds like mommy, or they may block on sounds and words with no sound coming out at all, like this. Some children who stutter may also have behaviors such as eye blinks, looking away, or physical tension around their mouth or other parts of the face. In addition, some of the struggle and tension can be heard as a rising pitch, like this. Here are some examples of children stuttering.
We're going to put this over his head so his head doesn't get hurt. When I grow up, I'm going to be a policeman like Daddy. It's for me.
Oh.
My dad is busy.
And maybe I can call them back later?
He bye. The puppets, yeah, me with that, el lema es porque ellos tienen, cuando él dice algo, es porque es de verdad. Ding dong, ding shoe, where the kitchen floor. She tripped over the garbage can.
What's that?
Oh!
If your child is showing one or more of these signs of stuttering, you'll naturally be upset, just as these parents are.
I actually became physically ill, worried, and I feel that feeling was based on the fact that I knew nothing about stuttering. There was something definitely wrong, and I needed to take some steps to get some help.
And as a parent who stutters myself, this caused a great deal of concern.
So yes, I felt very guilty. I felt like I had caused it, and I was the one person who had spent the most time with her. Mm-hmm. The other thing that hurt my feelings was everybody said, well, we never hear her stutter.
One of my concerns with respect to my daughter's, with respect to the speech problem that she was having, was that it would discourage her from communicating with other kids, and it would cause her to increasingly withdraw into herself.
All parents are concerned when they first hear their child begin to stutter. These feelings are normal, but experts agree that there are many things you can do to help your child right away. Here are some examples.
My name is Harry the Monster. How are you, little girl?
You got leaves for eyes. How come she doesn't want? How come she wants her to not take a break?
Well, she's not a very nice stepmother. 7. Now, Will, it's Chloe's turn to count. Will you count the balloons for me?
1, 2, 3.
There are additional things that parents can do. Let's listen to Leslie. What are still some triggers that might affect his fluency?
The main one, I think, and it took a long, that was something that we really tried to identify because we were told, try to really stay alert to what might be triggering this, what stressors might be, setting it off. And I think fatigue for Logan, my son, was the biggest. When he gets tired and, it's just, and he's also an emotional child, a first child. He just, he's a sensitive kid, and I think the main thing is if he's rested enough, the rest of him, he feels okay. He just needs, he kind of falls apart when he's overtired. And also, like I said, I just try to keep life as slow as I can. We need to keep it slower than I had it going for a while.
So the pace makes a difference for Logan.
It does.
And for you.
Yes, for all of us.
Be sure to have consistent bedtimes, regular nap times, and regular meal times. Discipline the child who stutters just as you would any child. Discipline promotes structure, so don't hesitate to set limits. Don't overprogram. Time spent just hanging out as a family is valuable. Turn off the television whenever possible. It can be a distraction. Be sure your child has plenty of time to get ready for bed and get up in the morning. Helping children know what to expect in their daily lives reduces stress and anxiety, whether they stutter or not. In spite of all these efforts, stuttering may continue to go up and down.
We've experienced a couple of setbacks where sort of spontaneously, and from what I've read from the Stuttering Foundation literature, this is not uncommon, that you have a setback. And all of a sudden they are blocking again and they are having a lot of tension.
One of the most frustrating things about stuttering is that just when you think it's gone, it comes back. However, that doesn't mean that your child can turn it off and on. What causes it to vary are the stresses of everyday life.
My older children starting back to school from the summer, I feel made her have a very difficult time. So the change in routine of our family, getting kids to school from summer was hard for her.
These stresses are in all children's lives, but children who are predisposed to stutter may react to these stresses with increased disfluency. To counteract this, we may want to provide extra support for these children during periods of change and stress. These same children may also have trouble when they have anxiety about new situations, go through language and growth spurts, experience potty training, or have too much excitement in their life.
He would either have periods of really great fluency, and then it seemed like as he was making new strides that all of a sudden he would become a bit more disfluent in the interim until he kind of get over that hurdle.
Some children may be more sensitive than others and may tend to be more perfectionistic. These children may have stronger reactions to their stuttering as well as to any changes in their routine.
And Nicole has the personality of, she can't do something right really well the first time. She shies away from doing it. She wants to be able to do something right away.
Become more aware of life events and stresses that influence your child's stuttering. Keep a notebook or journal about your child's ups and downs and how they relate to stuttering.
If you don't see a gradual decrease in your child's stuttering within a month, it may be necessary to seek help from a speech-language pathologist experienced in working with children who stutter. This may take the form of counseling over the phone or in person, or you may want to take your child to a speech pathologist to be tested. We call this test an evaluation. It will help identify risk factors and how they may contribute to your child's stuttering. It's important to understand these factors as they help the therapist plan and carry out treatment for your child.
Once I contacted you, I felt much more at peace with the fact that I would learn about stuttering myself and that we would get the proper help for Hunter.
We felt immensely better once we spoke to you and scheduled the initial screening, because we felt that we were proactively doing something.
I called a center where we were living, and I talked to the woman who was head of sort of the pediatric speech and language program there, and I mean, she got right on the phone with me, and after about a half an hour of talking to her, I was a changed person. She just calmed me down and told me what I could do immediately to help, and that was basically slowing down my speech and also just slowing down life, and assuring Logan that everything was going to be okay, that you know, addressing the problem and telling him, yeah, sometimes it is hard to speak, and it takes some people longer to learn how to do different things, and you know, maybe it's taking you a little bit longer to learn how to speak right, but we're going to go get some help, and everything's going to be okay. It's pretty much, you know, what she told me to say, and I swear within, you know, a day, he was already better. I mean, just having him know that it's amazing, you know, at 4, how mature they can be, but he felt a lot better just knowing that we were going to take care of it.
In this section of the video, we'll talk about evaluating the child who stutters. First, we'll talk about the factors that put the child at risk for stuttering. Then we'll give you some examples of children who are at risk for stuttering. And third, we'll talk about the components of an evaluation for children who stutter. Most experts agree that some children are born with a predisposition to develop stuttering. Whether or not they will depends on how the child's physical makeup interacts with his environment as he develops.
Children with relatives who continue to stutter into adulthood are less likely to recover without therapy.
About as many girls as boys begin to stutter, but girls are more likely to recover without therapy.
Children with good speech and language skills are more likely to recover without therapy.
Children who are more sensitive are more likely to react to their stuttering and to events around them. Therapy will focus on reducing their sensitivity.
The frequency, variability, and types of stuttering and the child's reaction to it help us plan therapy.
The way you feel and what you do in response to your child's stuttering can affect the outcome of treatment. The best way to help your child is to learn about stuttering and accept your child and his speech.
You can help your child by learning about how your family communicates and what effect it has on your child's stuttering.
Are your expectations for your child in line with his abilities?
Expect that important life events, like a move or the birth of a baby, will be stressful for some children.
Many children have trouble keeping up with a busy and rushed family schedule. Examine the effects of your lifestyle on your children.
Remember, some of these risk factors are found in all children. How they affect a particular child depends on whether he has a predisposition to stutter. In this case, a combination of these factors may trigger stuttering. Here are 3 children for whom different risk factors have been identified. Joe is a 3-year-old boy with 3 older sisters. He has a big vocabulary, enjoys talking, but is difficult to understand because he can't say certain sounds accurately. He and his parents and sisters are all fast talkers. His father stutters. When Joe stutters, he holds on to the first sounds of words, and the longer he holds on to a sound, the louder he gets.
Annie is a 2.5-year-old girl and a first child. Her baby brother was just born, her mom has returned to work, and now Annie must go to a new caregiver. She's a sensitive child and reacts strongly to new situations. Her stuttering is highly variable. Some days she has easy repetitions, and some days she struggles to get words out.
Peter, a little boy, is nearly 5 years old. His mom runs a daycare in their home, and the days are very hectic. When Peter gets stuck on words, sometimes his father tries to say the words for him. When Peter stutters, he takes deep breaths and often jerks his head back.
One of the most important benefits of an evaluation is that when risk factors such as those you just saw are identified, the clinician can plan a more focused and effective treatment program for your child. The evaluation consists of a case history, a family interview, an examination of your child's stuttering and other speech, language, and hearing skills, and a conference with your family to discuss the results. You will be given a written report with specific recommendations for you and your child. You should expect the clinician to follow up with you until treatment begins. The cost for an evaluation may range from free in a public school to a couple of $100s in a clinic or hospital. Many insurance companies will cover the cost of an evaluation. Be sure to check your policy.
The next section of this video will describe therapy for children who stutter. First, we'll talk about changes you can make at home to help your child. Next, we'll describe how you can work with a clinician to change important aspects of the child's environment. Then we'll give you examples of how the clinician can work with you and your child so the child learns to talk more easily and more fluently. Finally, we'll show you samples of clinicians working with children to help them stutter more easily and thus speak more normally.
Treatment of stuttering in young children takes many forms and will vary from child to child over time. You'll begin by focusing on changes that you and your family can make. The clinician will help you make these changes and check on how they are affecting your child's speech.
The one-on-one time has worked well. We've set aside one-on-one time with Catherine for maybe 10 minutes a day, and both Kim and I try to do it every day, where we'll read a book or play a word game with her. It's given us the opportunity to more than just work with her speech, just to spend some time with her individually, because that can kind of get used up during the course of a day if we don't consciously make the time to do that. So that's worked out well.
We made a real effort to slow our pace down, to not get involved in as many activities as I could sign up for, and there's so much out there, a lot of fun activities for kids, but I've learned how valuable it is for us just to be together, for me to sit and read with him using my easy speech and modeling, which I didn't talk about so much before, but that whole idea of modeling slow speech has made a big difference also for Logan. So we have slowed the pace, tried to slow the pace in every way.
So it's really just unlimited patience, and I try to not finish sentences for her. I try not to hurry her or to rush her, and I try to calm. Maybe sometimes if we're in a little bit of a hectic situation, I just realize it's more important to take the time to listen, and I'll happily listen until she feels she's done speaking.
And also I have made and still continue to try to keep life as slow as I can and not over-program, and make sure that he gets enough rest. And it seems to really matter for him. I can see I've become more sensitive to what is too much for him.
Let's review what you've already learned to do to help your child. You're working on using slow speech, pausing, finding more one-on-one time, reducing the number of questions you ask, and improving listening skills.
If your child needs further help, your next step may be more frequent meetings with the clinician who will work with you to make these changes.
I think the suggestions that you gave to us initially when we first called on you for help, and the things we learned during our time together in family therapy about modeling, about speaking more slowly to Hannah, pausing and letting her have time to take turns in the conversation. I think that those were wonderful, that was wonderful advice to us that really taught us how to speak to our daughter. That is good advice for any parent, whether or not your child has a problem.
But a lot of it still carries over, especially a slower, easier speech that you were teaching, that we were working on together. I think that that's something that in fact, not just my kids, but whenever I'm dealing with any kids, now even friends' kids, I always try to speak in a slower, easier style with them.
Also at home, we've implemented a thing at the family dinner where everybody takes a turn and you pass the candlestick around, and when you get the candlestick, it's your turn to talk, and everybody listens and doesn't interrupt, and then when that person's finished, they pass it on to the next person.
Because it was hard not to ask questions. For example, Marsha, as she was saying, would be saying, "I've got the blue whatever." Usually, before that, we were always, again, trying to provoke a response. "Hannah, what color is yours?" Or "Hannah, this," or "Hannah, what's that?" But instead, we had to totally alter our communication pattern there by saying, "I've got the blue one," and I'd say, "I've got the green this," and that would be Hannah's turn to say something, whatever she felt like saying at that point, instead of us trying to stimulate the response from her.
If your child isn't showing substantial improvement, or if the evaluation has identified a lot of risk factors, your child may need to work with a clinician to learn to talk more easily. You'll also want to continue your efforts at home.
But there's no room.
There's no room for another one, is there? No. Would you make me some desserts so I can eat them? Would you make some for me? We're moving our hand like this. Let's try a blue one now. One. Let's try it like this. One. Again. One. Good. Say it just like I do. Say it with me. Okay, good. Two. Good. Let's do it like this now.
Now it's my turn.
Okay. All right. Why don't you let me say it with you? Can you say it like this? 3, and then I'll say it with you. Ready? Okay, you say it now. 3. Good. You're showing me how to do it now. Okay? Let's try it again. 4. Good. You're a good teacher. You're showing me how to count with our stretchy. So instead we would say slowing down means pausing more. That's one way to slow down. It means some of the stretching that you heard me do before with him. That's one way to slow down. We were playing a little game with it, and he was mimicking me in game fashion, and I was mimicking him in game fashion, but it wasn't like, I want you to slow down so you don't stutter. At least hopefully it wasn't coming across that way. So there are activities like that that you can do at home during reading time, when you and your husband are interacting with him, which we would encourage on a daily basis to have just time for Nikki, 10, 15, 20 minutes a day.
And that's no problem for us.
If your child continues to show physical struggle with stuttering, shows frustration, or avoids words or situations, then your clinician may begin to work more directly with your child in some of the following ways. She will learn to practice easy speech skills, feel the difference between hard and easy speech, between bumpy and smooth speech. She will talk openly about stuttering and learn to stutter more easily.
Let's start with this one. Horse. Does that sound smooth or does that sound bumpy? Good listening, Mackenzie. That was smooth. We've been working on easy, relaxed speech. You and Mom have been modeling that beautifully, but we're finding that she's still having a significant amount of blocks. And so one of the things that we're doing now is we're working a little bit on understanding the concepts of smooth and bumpy through maybe how objects feel. I'm having her identify some of my words when they're smooth or bumpy. And then I'm going to be continuing to reinforce her that it's okay to be smooth and it's okay to be bumpy.
The first thing they did was sort of intentionally help Logan identify the different kinds of disfluencies that he would have. And so whether it would be bumpy talk, they had their own language for what was, the bumpy talk, or Mr. Freeze, they called him, when he would block. And they had a whole language, and he would intentionally do that for his therapist, and then when it would happen naturally, and then they would practice, how to get out of it. When they would practice it intentionally, and then practice how to get out of it. So then, when it would happen naturally, he would know how to work himself out of, the different disfluencies that he might experience, and he got to the point where he really could do it.
Remember, you and your family are an important part of treatment and should continue to play an active and caring role in this process.
I needed to be trained as much as Logan did. I didn't know what easy speech was, or how to help him recover, or help him learn the strategies to for how to get himself out of some of the bumpy talk and the blocking that was happening.
You've just seen a range of possible treatment options available for you and your child. We hope you feel confident that your child can be helped. And remember, your active involvement can make a real difference.
You can call the Stuttering Foundation at 1-800-992-9392 for the names of some specialists in stuttering in your area, or visit us at www.stutteringhelp.org. Here are several Stuttering Foundation publications which will help you to help your child.